So looking at the questions coming from orthopedic oncology, a 30-year-old man presents with swelling over the knee joint. Biopsy reveals mononucleus in giant cells. What is the diagnosis? Your diagnosis will be giant cell tumor, also called as osteoclastoma. Question number 2. Which of the following are true for osteoid osteoma? Night pain relief to salicylates. True. Nidus can be seen. True. Can present with pathological fractures. No. Benign entity. True. Malignant. No. Question number 3. 9-year-old boy presents with a lytic lesion on the tibia. So you have a lytic lesion. On histopath, there are groove nuclei, giant cells, eosinophilic cytoplasm, fibroblastic proliferation. What is your diagnosis? So when you have a lytic lesion with groove nucleus, you talk about Langerhans cell histiocytosis. Which of the following is a sign of metastasis? We did this when there is a destruction of one pedicle called as winking owl sign, or both the pedicles called as the blind bat sign. Most common type of fibrous dysplasia, 75% cases monostotic. Middle-aged patient presents with a back pain. On bone scan, osteolytic lesions are seen. Which of the following can be a possibility? So when you have a middle-aged patient presents with a backache, on bone scan, osteolytic lesions seen, which of the following can be a possibility? Osteolytic metastasis. When I look at the osteolytic metastasis, I need to first look at the causes of osteoblastic mets. Prostate, osteoblastic. Carcinoid, osteoblastic. Medulloblastoma, osteoblastic. Paracetamol is the mnemonic. Prostate is classically osteoblastic. So answer will be kidney. Remember, kidney and thyroid, they have lytic lesions which are also pulsatile metastatic. 70-year-old male, single well-defined lytic lesion of skull. Patient has no other complaint. Urine examination has no abnormality. What is the diagnosis? They are showing you Langerhans cell histiocytosis. Question number 8. Patient of a GCT, which of the following is false? Chemotherapy can never be the treatment. Which metabolic condition can have phosphaturia and osteomalacia? Remember, fibrous lesions of the bone can cause oncogenic osteomalacia. So the answer is fibrosarcoma, and they will secrete phosphatonin, which is responsible for phosphaturia and osteomalacia. Question number 10. What's your diagnosis? You have a lytic lesion going till the end of a bone, destroying the bone. This is classically GCT. Osteoclastoma is also in the option, that's also correct. But if both are there, I will choose one answer, GCT. If 2 times somebody has mentioned, I will still attempt it and mark the first answer in the options. I will never leave these options. So mark giant cell tumor. Regarding GCT, which of the following is true? Age group 20 to 40 after skeletal maturity. True. Proximal femur involvement can be seen. In fact, we saw the X-ray. Manage the extended curettage. Treatment of choice. Closest differential ABC. True. 3% cases have mesh to the lung. True. 10-year-old child presents with a mid-tibial swelling. Mid-tibial. Diaphyseal. X-ray has a lytic lesion with sclerotic margins. What is the diagnosis? So lytic lesion with sclerotic margin, nidus, osteoid osteoma. Most common tumor of hand. Many people mark enchondroma. Enchondroma is the most common tumor of bones of hand and feet. Most common tumor of hand is a malignant lesion called as squamous cell carcinoma. A 15-year-old boy presented with painful swelling over the left shoulder. before maturity, painful swelling. X-ray shows lysis with calcification over the proximal humerus epiphysis. Epiphysis plus calcification, upper end humerus, 15-year. Patient has giant cells. We are talking about chondroblastoma, which is a giant cell variant. That is why giant cells are there. Question number 15, 8-year-old child, so first decade. Complains of pain and swelling over the upper end of tibia. Upper end. Upper end can be metaphysis or epiphysis. Local temperature raised. Margins are irregular. Remember, when you have benign tumor, they have well-defined margins. Uniform consistency. So if you will touch a bone tumor, it will be throughout hard. Hard is bone. If you have a tumor which is coming from the cartilage, it will be firm. Nose is firm. If you have a tumor with a soft component, it will be soft, like the lips. Hard, firm, soft. Benign tumor, throughout uniform consistency. One component. Whereas malignant tumor, somewhere hard, somewhere firm, somewhere soft. Because of variable rate of destruction, liquefaction, called as variable consistency. Benign tumor, uniform consistency, well-defined margins. Malignant, variable consistency, ill-defined margins. This consistency is very important. So here you have high local temperature, irregular margins, variable consistency. So we are talking about a malignant lesion. So malignant lesion involving the metaphysis or epiphysis. Think about osteosarcoma. Ewing's is diaphysis. GCT is epiphysis but not malignant. And metastasis don't occur in the first decade. So when you have age, Ewing should have been the answer, first decade. But part, metaphysis. So you chose part over the age. So the answer is osteosarcoma, also called as osteogenic sarcoma. Ewing sarcoma associated with genetic defect. As a reflex, you want to mark translocation 2211, but that's wrong. It's 1122. So the answer is trisomy 8. And then most common tumor of mandible. Remember, it's squamous cell carcinoma, which happens to be the most common tumor of mandible. This is all about orthopedic oncology. Thank you very much.